It is March 18th at around 8 o'clock a.m. and I just wanted to give you this quick update. I am 2 days post-surgery, post-VSG surgery. I ended up going up to Dr. Sarangle in San Francisco, and he did just an amazing job. This surgeon is extremely experienced, makes you feel extremely comfortable. The process was very easy. And I wanted to, just give you a rundown on the emotions I went through, the feelings I went through, all that kind of stuff. Maybe the recovery afterwards. So for me, it was fairly easy. I had started to lose some weight prior to the surgery. I think my highest was around 332, and the day before of leaving for the surgery, the day I left for the surgery, I was 303. So I definitely had shaved off a good amount of pounds there. But went in, met with the doctor for a few minutes, got prepped, met with the anesthesiologists. Everybody was real helpful, asked if I had any questions. Went into surgery, which is an awkward experience just because I've never done it before. So you have to walk yourself into the OR. You lay down and they're real friendly and talking to you, and in the midst of the conversation, all of a sudden I'm out. And feels like 10 minutes later I woke up and that was it. The only part that felt really odd to me was just simply that I felt so extremely tired, and that's obviously to be expected based on the anesthesia. So I felt really hard to keep my eyes open for a couple of hours. But everything went very smooth. The doctor said he was able to make my larger incision smaller than he typically does, and there was no issues inside or anything to be aware of. There was a couple other patients in the recovery area at the same time. They all had the same surgery. A few of them had a difficult time, more difficult time than I did. I know the one woman I spoke with said she couldn't even get a little bit of water down without throwing up. I didn't throw up at all. I did feel a little nauseous. I'd highly recommend take the pain and nausea medicine just simply so you feel better because it helps the healing process. I also found that the gases that were in me, because they pump you full of gas in order to be able to see in there, didn't want to come out very easily. So it took a good couple days before I was able to pass gas. And this morning and yesterday I think was the first times, and definitely feels a lot better. But looking at my stomach, I feel very bloated. It looks very bloated. And I checked on the scale this morning just for the heck of it, and it actually showed that my weight went up to 308, where it was 303 the day before. Even after taking, a large portion of my stomach out. But I believe that that's probably just the water weight that's left on from the IV that's been in me for the past couple of days. So that's it right now. It's definitely gotten a little easier to mobilize. I go for walks pretty regularly. I have been taking protein shakes as my 3 meals a day kind of a thing. And I started back on my vitamins. I take my antacid because I was told to do that for a few months just to get my stomach neutralized. And right now I feel good. Everything feels good. I don't feel anything out of place. The biggest pain at all that I'd have right now would be in the muscle underneath the larger incision. That's the biggest pain. And that one, it hurts to lean on, it hurts to touch, it hurts to, use your muscles in your stomach to lift yourself up because of that one cut. But other than that, everything else feels pretty normal. So hopefully you get the same experience, and we'll go from there.